Hello doctors. So we now saw that preparation of the teeth requires some principles. So we spoke about the principles of tooth preparation. Now we will see how is the tooth preparation itself done for a partial or a full veneer crowns. Now a full veneer crowns can be of complete cast crown, it can be all ceramic crown, it can be metal ceramic crown depending on what is the patient's desire as well as what is the indication for that particular area. Now coming to the indications of tooth preparation. Now extensively destruction from caries or trauma or endodontically treated teeth which is there. Existing restoration that needs the use of a more conservative restoration. Necessity for maximum retention and strength. To provide contours and to receive a removable appliance, for example telescopic crowns, or other recontouring of axial surfaces, minor correction or malalignments that has to be considered, and correction of occlusal planes. Those are the indications for tooth preparation. Coming to what are the contraindications. It should not be used in a mouth with uncontrolled caries because the oral hygiene is not maintained, so we cannot use in those patients. Less than the maximum retention necessary. Advantages are to be considered that it is strong, high retentive qualities are present. Then we have usually easy to obtain adequate resistance form, option to modify the form and occlusion is present to us. We have contact areas that can be conventionally developed. We have embrasure areas that has to be enhanced. These are the advantages. Coming to the disadvantages, that is removal of a large amount of tooth structure is there because of giving the preparation of the crown. Adverse effects on the tissues can happen. Vitality testing not readily feasible with all the dentists. Display of the metal is another disadvantages in these kinds of crowns when we are preparing. Now let's see what are the features of full veneer crown preparation and a function served by each area. Now we know that the planar occlusal reduction, when we are doing occlusal reduction, we are not supposed to do it flat. We are supposed to follow the contour of the crown. So that is called planar occlusal reduction. Why is that so and what is its importance? Now structural durability is the important thing. How is structural durability coming into question here? Because when we are giving it flat, that means the metal over there will be as 0.3 mm, but the ceramic thickness will increase. So the force when it will put, it can chip off the ceramic. Whereas if you are going with a planar reduction, according to the cusp, the metal and the ceramic will be appropriate in its thickness and there will be no question of fracture. Coming to the functional cusp bevel, again that will give structural durability because that is a functional cusp. So the chewing is going to happen onto that cusp, the force is going to get more on that cusp. So more that area is reduced, we give a bevel in that area so that the metal thickness is increased and the ceramic is a little less. More force can be taken over without fracture of the ceramic. Coming to the seating grooves that we need to give, that is to increase the retention and the resistance form so that it doesn't go ahead with the force of gravity or come out because of any sticky kind of foods. Axial reduction is again important, even that will give resistance and retention form. Now let's see the features of an anterior porcelain fused to metal crown preparation on an anterior teeth. What are the things that we will see? We have a chamfer on the back, shoulder in the buccal region, axial reduction, wings will be present, the incisal notch is there. Now we'll come to one by one in all these. Features of posterior, what all will be there? Planar occlusal reduction. We have a counter sink area in this. We have bevel, we have occlusal offsets given, we have grooves, we have functional cusp bevel, we have chamfer in the posterior of the lingual side and shoulder in the buccal side. We have isthmus, we have axial reduction. The features of all ceramic, what all should be? Shoulder everywhere or radial shoulder or heavy chamfer. Axial reduction should be same. All the line angles and your point angles should be rounded off because there is no metal. So it is all ceramic. So when it is all ceramic, the force will be more concentrated on the ceramic. We need to keep it no area of load should be there. Stress, concentration should not be there in anything. vertical lingual wall, and we have a concave cingulum reduction in this particular area. The features of a cast ceramic crown preparation for all ceramic crown or in posterior teeth will be all the same: rounded off angles, axial reduction, shoulder finish line, or it is actually called radial shoulder finish line, functional cusp bevel. We'll come to one by one. Partial veneer crown, it can be 3/4 crown, it can be 7/8 crown, it can be mesial half crown, depending on the caries. If the caries is just present or the destruction has just happened to mesial half, you will prepare the mesial half and give a crown over there. Preservation of the tooth structure counts over here. Now, indication of partial veneer crowns that we will come to. So what are the indication? The partial veneer crowns are a conservative measure and are preferably to the complete veneer restoration. Now, indications include that intact or minimally restored tooth. We have to have a teeth with crown length that is average or that exceeds the average. We have teeth with normal anatomic crown form, that is without excessive cervical constriction. Anterior teeth with adequate labiolingual thickness. No conflict should be there between axial relationship of the teeth and proposed path of withdrawal of FPD. That means that the axis of the insertion and removal should be same. Coming to contraindications of partial veneer, high caries rate, unprepared surface as well as increased margin susceptibility to caries, we cannot go ahead with those cases. Teeth with extensive restoration, partial veneer crowns are preferred on sound tooth, not on excessive destruction of the teeth where it has happened. Deep cervical lesion, difficult to establish a finish line, do not go with partial veneers. If area is sensitive, complete coverage crown is a better option. Teeth with short clinical crown where retention will be a problem again, resistance form and retention form will be difficult to achieve. Aesthetics will be compromised because of bell-shaped teeth. Those requires more of cervical reduction due to the convergence, which might cause damage to the pulp at the end of the day. Thin teeth, there is a preparation of retention groove is difficult in those kind of teeth because we will go near to the pulp and destruct and make the teeth non-vital. Coming to the advantages of partial veneer crown. Partial veneer crown has several advantages over complete crown. The first is preservation of the tooth structure. The tooth reduction is conservative. The aesthetics surpass the complete veneer cast margins crown. Margin accessibility for finishing and cleaning is improved. Complete seating of the casting is more essentially verified. Complete seating of the casting during cementation is enhanced by diminished hydraulic pressure. Electric pulp testing can be conventionally accomplished on the intact enamel surfaces. These are the different advantages of partial veneer crown. Has to be some disadvantages. So the disadvantages for a partial veneer crowns are that the partial veneer crown have the following disadvantages. Like the partial veneer crown is not as retentive as a complete veneer crowns. There is a limited display of metal with the partial veneer crown. Skillful preparation is very important and critical to avoid metal display. The partial veneer crown preparation is limited to fairly intact teeth and normally shaped crown and an average clinical height of the crown when it is present. And if these things are not present, then we cannot go ahead with a partial veneer crown. Now let's see what is the sequence of tooth preparation for any teeth. Now coming to the sequence of tooth preparation. So now we saw that any different kind of tooth that is to be prepared for receiving metal ceramic, all ceramic restoration, partial veneers or complete veneer crowns, that metal if it is metal ceramic or all ceramic, all have got different features. So for that we need to start with the sequence of tooth preparation. How are we going to achieve that? So first thing that we need to do is make a putty index. Now what is a putty index? We take a addition or a condensation silicone and put it over the natural teeth if it is natural contour is present, and it has to be prepared that tooth can be made an impression of that particular putty. If this is my tooth, I will take my putty like this and I will put it over and make an impression of that particular only small section. Now that putty will act for many important was. First thing, the putty will say us, when you will cut the putty in occlusally, you can view that how much amount of tooth preparation is done. If this was my original teeth, my putty will also be in this area. Now if I have done a tooth preparation till here, now we can see a distance. This distance will say us that how much tooth preparation is done, because every tooth preparation for a metal or a metal ceramic requires a particular of thickness. So for metal ceramic, like we know, we require at least 1.5 to 2 in occlusion. How will we get that? So putty will say how much distance between the putty, the original teeth which was present, and how much you have prepared. So now we know exactly that how much of distance we have prepared. Second thing the putty will solve us the problem of temporization. In the future appointments or very soon next appointment, we can give the temporary to that particular crown if it is vital. So putty index is of importance. Now putty index cutting is there. Now where all we will cut the index, now we will do a facial lingual half and we will do a mid-sagittal half. That is, we will cut it from the occlusally from top, and also we will cut from mid-sagittal section. Now what will that help us in? The mid-sagittal section or the occlusal cut will show us that how much buccally and lingually we have to prepare, and we have prepared. The facial lingual halves will show us that how much mesially and distally we have prepared. So this is how we will see when we are putting one putty, the facial half, we will see how much reduction we have done. Similarly, we'll put the other. This will improve us in getting the exact occlusal clearance as well for the crown that has to come out. Now the biplanar reduction, this is very important. We saw that axial reduction in all the crowns that we saw, metal ceramic, there was axial reduction. Now axial reduction is fine, but biplanar reduction facial is very important because our natural teeth do have this biplanar thing. It is in two planes, 1 and 2. You can see this is one plane, this is another plane. So our tooth preparation should also follow not straight line but a one plane and another plane. So biplanar, two plane reduction is important. How much should be done? This two planar biplanar reduction, it should be 1.5 to 2 Why do we take 1.5 to 2 always? Because for a metal ceramic crown, a metal thickness should be 0.3 to 0.5 and that of a ceramic thickness should be 1.2 to 1.5 Addition makes it 1.5 to 2 Coming to very first initial step, that is the depth orientation grooves. Before biplanar reduction also, we need to do this depth orientation groove. Now this depth orientation groove will say us exactly how much should we prepare. That is, our bud that we are going to prepare, diamonds that we are going to prepare with the teeth have got a particular thickness, that is 1.5 when you sink it down. So when you have sinked it up totally down with the tooth structure, that means 1.5 we have gone down. So this depth reduction is helping in two ways. One, see, this is a biplanar depth orientation, one on this direction, one on the down direction. So biplanar is done, number one. Number two thing that we have done is this thickness of this diamond is 1.5 We have sinked it down to 1.5 So that means we have to prepare till these grooves are gone. So that means we will be exactly ending up to 1.5 or 2 probably because of the lines. So for incisal portion, how are we going to do? Again, these are the depth orientation grooves with the diamonds. How much we should be requiring in incisal end? That is again 1.5 to 2 So we will do a 1.5 to 2 depth orientation and then we will chip off. Chipping off should be considered with the rounded borders. That is another important thing. Because to reduce the stress concentration, anything where there is sharp, stress concentration is more. When it is rounded, stress concentration is not there. Facial reduction or incisal half reduction is taken place, that is, this is not shown facial reduction, this is shown the lingual reduction. You can see the cingulum area is reduced, and again you have to give the depth orientation grooves in the cingulum area and then prepare this wall. Now this wall which will be prepared should be parallel to this wall, facial end wall, that is a cervicofacial wall. These should be parallel because the seating of the crown will be decided with the parallelism of this wall and this wall. So facial reduction, we can see the incisal half is reduced. Lip of enamel. Now what happens in the side? When we are removing from interproximal area, when we go from buccal towards lingual. Now if this is my tooth and I am coming from buccal to lingual, now I am reducing this. There will be a lip of enamel which is present. Keep it over there. come from the lingual preparation. Prepare the lingual also. Now there will be small unsupported lip of enamel which is present in the contact area. Breaking the contact area is very important. So now take an explorer or take a chisel and just break it off, or also do it with the help of a burr. But most important is contact break is important at the end of the day. So lingual reduction is also done. Now how will we do the lingual reduction in the cervical area? Will be done with a straight fissure or a tapered fissure burr. In the cingulum area we can do a round wheel diamond, or we can also use a flame shaped burr to do this preparation. Potholes is that with 1.4 mm round diamonds we can do the potholes which is present. Lingual reduction should be following exact shape of a lingual anatomy of an anterior teeth. That is, that it should have a cingulum very nicely, and then there should be a lingual wall. Now that lingual wall should be again parallel to the cervicofacial wall because of the placement of the crown. We can see lingual axial reduction. See this one and this one is almost parallel and has to be parallel. So let's talk about the finish lines. What should be the finish line in the buccal side? What should be on the lingual side? When we are receiving a metal ceramic crown, we have metal and ceramic. So shoulder, we have spoken that in principles of tooth preparation, and lingually we can have a chamfer. If we are preparing an all ceramic, we should have all over. What should we have? That is the heavy chamfer or a radial shoulder finish line. Similarly, in cases of all metal, we can have chamfer all over. Now proximal reduction, how we do that? Proximal reduction, we spoke that small lip of enamel will be present. We will break off those lips of enamel and there will be the proximal reduction. Most important thing, you have to do with a long needle diamond. One, because you have to reach to the contact area of the adjacent teeth and break that contact area. That is important. Lingual margin, as I told you, depends on the particular crown that is going to come. For metal ceramic, it will be metal on the lingual side. So why do we keep little metal on the lingual side? Because while you have to remove the crown, for in any case, the metal will be destructed, not the ceramic over that. So that has to be a chamfer, metal chamfer. Facial axial finishing, all the finishing has to be done with a yellow tapering. Facial axial finishing is done, then round over sharp angles. There should be no sharp angles present, because whenever there will be sharp angle present, there will be concentration of forces. So rounding off all the entire finish line or all the tooth preparation is important. And shoulder finishing. The final finishing will be with the finish lines, that is the finish line geometry has to be maintained. Verification of the preparation from the top, you have to close your one eye and verify the preparation that from the top you can be in eagle's eye. This is called the eagle's eye view. That is from the top when you are seeing with one eye closed with the distance of 15 to 25 mm. Now what we will find out is that the undercuts will be seen properly, that there should not be any undercut. All the finish line should be exactly seen with a nice prepared tooth over it. So now we have a chamfer in the lingual side, shoulder in the buccal side, axial reduction, biplanar, wings we have, and incisal notches we have. This is what I was talking about in the starting, that this is how the entire preparation comes into picture. Now coming to the posterior PFM, or the porcelain fused to metal for the porcelain posterior teeth. Will it be different? No, there will be no difference much, but there will be certain things which will be modified here. That is, putty index remains the same. You have to make a putty index of the tooth which is already present and cut the putty index in facial lingual direction and as well as in the mid-sagittal plane. Now after the putty index is done, the occlusal reduction will be biplanar, of course, because even the buccal contour of a posterior teeth is also biplanar. So even that, the preparation is also supposed to be biplanar with the help of depth orientation grooves. That is 1.5 to 2 mm. Again, preparation is important with diamond end tapers. Occlusal reduction, again the same, keep the putty index and check for 1.5 to 2 mm. With that of opposing occlusion also you can check. Another way of checking occlusal clearance is with the help of wax. You keep the wax and then ask the patient to bite. If the wax is not getting perforated, the thickness of the wax is 1.5 mm. So that will not get perforated, that means you have achieved a minimal good amount of occlusal clearance. Functional cusp bevel is very important in a posterior teeth. Buccal upper is a non-functional cusp. So in the palatal surface of upper and the buccal surface of the lowers, which are going to occlude with each other, has to be given a bevel. Now that bevel will act as a structural integrity to the tooth, because the stress will not be more over there, as well as on the ceramic, because the metal will be more over there. So the functional cusp bevel is important. Depth orientation groove remains the same. Facial reduction starts with 1.5 to 2 mm. Put your putty index. See how much reduction you're doing with the help of a diamond. Depending upon what crown you're going to give, maybe metal, then you have to use a chamfer burr. If it is a metal ceramic, then you have to go ahead with the shoulder preparation burr. That is the tapered but flattened. If it was chamfer, then it would not have flattened. Gingival half preparation is done, and then we go with the proximal or the axial wall preparation. Same way we go ahead with the wing preparation here. Same way we go ahead with the wing preparation here. That is, from the facial side we will start the preparation, end it in the halfway, come from the lingual, end it in a halfway, and then the unsupported enamel will be broken off with the help of exploder. Very important is breaking of the contact in the posterior region. Lingual axial, as I told you right now, first will come with facial, then you will come lingual. This is the unsupported enamel which is present. You will break it off with the exploder. Axial finish lines will be again based on which crown you are giving. If you are giving all ceramic crown, it will be radial shoulder or a heavy chamfer. There should be no sharp margins, even in the margins, in the marginal area. Finishing the facial and proximal surfaces after your entire preparation is over. Verify your preparation with the eagle view, and then find out if there is any undercut. Modify the undercuts and make it in a parallel path of insertion so that there is no freedom of displacement. And once that is achieved, now you have to find out that take the yellow diamonds, and then you have to finish the entire preparation so that there is no line angle present, no insufficiency or no irregularity in your preparation. So finishing is important. Rounding over the sharp angles are important, and finishing shoulder is important. You have to finish the entire shoulder line. If you have a chamfer on the particular lingual side or palatal side, you have to finish the chamfer as well. The margins has to be finished. Gingival bevel is again important at times. Gingival bevel again, that is required because your teeth will also get supported in the cervical area with the help of the crown which is coming. So that gingival bevel in this region is also important. So the complete preparation is now seen from eagle view to find out if all the things are proper, like the chamfer finish line, the lingual axial recompton is there. There is a wing which is present, facial axial reduction, shoulder in the buccal area, gingival bevel is present in the buccal region. Functional cusp bevel is given, that is most important. Planar occlusal reduction, another important thing that we have to notice. All these are also verified with the help of the putty index that we had taken in the front in the starting for two reasons. One, temporization, and one for verification of our entire restoration or the tooth preparation for the restoration that is going to come.